Why, hello, I'm Paul Takahashi. I'm a primary care internist and geriatrician in the Department of Medicine at Mayo Clinic in Rochester. I'm also involved as a co-medical director within the Mayo Clinic Biobank. I'm here today to talk a little bit about our study, hospitalizations and ED visits within the Mayo Clinic Biobank and its impact upon the employee and community health population. The major aim of our study was actually to compare the differences or the similarities between the biobank as well as the ECH community. The employee and community health community involves all of the primary care patients within southeastern Minnesota who are currently being cared for by Mayo Clinic Rochester. This population gets most of its care within outpatient clinics in Rochester and receives most of their hospitalizations and emergency room visits at one of the two major hospitals in Rochester, Minnesota that are affiliated with Mayo Clinic. The Mayo Clinic Biobank is a shared resource within Mayo Clinic institution, including Mayo Clinic Rochester. We looked at a small subset of the population of the Mayo Clinic Biobank, about 8,900 patients, and saw how well what were the rates of admission and emergency room visits as well as 30-day rehospitalizations based upon medical tiering. Medical tiering is a term or a concept where we try to risk stratify people based upon the number of conditions that they have. If you are an individual who doesn't have a medical problem, you'd be considered a tier 0 patient. If you're an individual who has multiple medical problems such as heart disease, cancer, diabetes, you might rank in what we call a tier 3 or a tier 4. Those are considered the highest risk of our patients. So what we did was we compared the admission rates for both the hospital and emergency room primarily in those people within the biobank who had given consent and given blood and filled out questionnaires compared to the ECH population as a general. That included all of the individuals who were enrolled in family medicine and primary care internal medicine. What we found was that as medical tiering, as medical complexity goes up, the risks of hospitalization and emergency room visits also increased. That was something to be expected based upon previous studies looking at risk stratification techniques, including elder risk assessment, ACGs, which also show that as you get sicker, you're more likely to go to the hospital or the emergency room. The important finding from our study was that the comparison between the biobank and the ECH community, the overall community, was fairly similar, in fact was similar, in terms of emergency room visits, hospitalization between those two groups. The biobank population in general had more females, they were older, a little bit sicker, but in general the comparison and how well the tiering and the risk stratification worked was similar between both the ECH group as well as the biobank. We can actually use the Mayo Clinic Biobank for primary care studies for risk stratification. We'll be looking at different type of questions such as biomarkers, genetic testing to see if we can better risk stratify people who will be at the highest risk for hospitalization. As we move into the 21st century, and as we are in the 21st century, we recognize that trying to reduce these hospitalizations, rehospitalizations, and emergency room visits will be a key component to our care. We hope we can find other modifiers other than just strictly illness to help determine those questions. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.